Good afternoon. My name is SharikaTalford. I will be discussing the pathophysiology outcomes for Mr. Johnson. Mr. Johnson was diagnosed with acute prostasis, which is the inflammation of his prostate caused by excessive prolonged sitting at work and cross-fitting workouts and personal hygiene. The bacterial organisms commonly discovered are E. coli and gram-negative rods. Mr. Johnson will be treated with antibiotic therapy for 1 week with Cipro or Levaquin. Mr. Johnson will be advised to stay away from spicy foods, sexual intercourse for the next 2 weeks. After several days of oral antibiotic therapy and symptoms progressively get worse, Mr. Johnson needs to report to the emergency room for further medical treatment, possible development of an abscess in his prostate gland. Mr. Johnson will probably have to be on intravenous IV and broad-spectrum IV antibiotic therapy. And after a couple days receiving antibiotic therapy and symptoms has resolved, Mr. Johnson will follow up in the office in 2 weeks with the urinalysis results and a baseline PSA. Patient is at high risk for developing prostate cancer in his future, so I will have Mr. Johnson to follow up in my office every 6 months for a baseline PSA. After Mr. Johnson returns back to work, he will avoid prolonged sitting, and after CrossFit workouts, Mr. Johnson will enjoy a warm bath to prevent bacterial growth. Thank you.